What if you could know a month in advance that you were at risk of a stroke? Would you be able to recognize the early warning signs? Could you take steps to prevent it? Imagine waking up one morning and finding that you can't move your right arm or leg. You try to speak, but your words are slurred. You're terrified, and you don't know what's happening. This could be the start of a stroke, a medical emergency that happens when the blood supply to your brain is interrupted. Strokes can be deadly or leave you with permanent disabilities. In this video, we'll discuss the early warning signs of stroke before 1 month. We'll also talk about how to prevent strokes and what to do if you think you or someone you know is having one. The brain is a sophisticated organ that regulates a number of biological processes and functions. Brain damage that is irreversible may result from a stroke. But before moving to signs, we have to know about what is a stroke. In USA, strokes are the 5th most prevalent cause of death and a major contributor to disability. A stroke is a medical emergency in which the blood supply to portions of your brain is diminished or stopped entirely, preventing the brain from receiving the right amount of oxygen and nutrients. Brain cells can suffer damage and possibly pass away in a matter of minutes without oxygen and nourishment. Strokes need to be treated right once in order to prevent consequences like brain damage. There are 2 main types of strokes: ischemic stroke and hemorrhagic strokes. Ischemic strokes. An ischemic stroke happens when a clot restricts oxygen delivery to the brain by obstructing blood flow. Approximately 87% of strokes are ischemic strokes. Ischemic strokes are mostly brought on by fatty deposits that form on the lining of vessel walls. Most frequently, these fatty deposits result in obstruction because of a blood clot that forms at the fatty plaque of an artery or at another site in the circulatory system. Hemorrhagic strokes. When blood vessels burst during a hemorrhagic stroke, the brain tissue bleeds and the brain cells are damaged. Approximately 13% of strokes are hemorrhagic strokes. Hemorrhagic strokes are brought on by weak blood arteries that burst, bleed into the brain, and cause blood to build up and pressure the tissues around the brain. Subarachnoid hemorrhage and intracerebral hemorrhage are the 2 different forms of hemorrhagic strokes. What is pre-stroke? There may occasionally be a tiny transient clot that goes away soon. Because of how these clots affect the brain, pre-stroke symptoms frequently resemble stroke symptoms. A transient ischemic attack, commonly referred to as a pre-stroke, is frequently the precursor to a stroke that could be more severe. If a doctor notices that a patient had a pre-stroke, they might give a thrombolytic medication that can prevent further clots and lessen the chance of a more serious stroke. What are the early warning signs of a stroke? Knowing the signs of a pre-stroke and getting medical help are crucial since they frequently herald another stroke that could be more harmful or severe. Unluckily, a stroke that occurs after a pre-stroke may be more severe and even fatal. In some circumstances, a stroke can happen just 24 hours following a pre-stroke. On the other hand, a more dangerous stroke may not manifest until 7 days following a less serious one. It is crucial to seek urgent medical assistance because it is impossible to foresee when a stroke will occur following a pre-stroke. In the event that a stroke does occur, seeking treatment can lessen the chance of irreversible damage and help prevent a more severe stroke. The most typical stroke warning signs and symptoms are FAST or fast warning signs. Only if the stroke is noticed and diagnosed within 3 hours of the first symptoms are the greatest stroke treatments available. Use the letters in FAST to spot a stroke. F equals face drooping. Is there a droop on one side of the face or is it numb? Invite the subject to grin. Is the individual's smile even? A equals arm weakness. Is one arm atrophied or numbed? To raise both arms, request the person. Do one or both arms sag downward? S equals speech difficulty. Is there slurred speech? T equals time to call 911. An emergency is a stroke. Every second matters. Dial 911 right away. Take note of the moment that any symptoms start to manifest. Other symptoms include numbness. Arms, legs, or the face may become numb all of a sudden. It usually only affects one side of the body when this numbness occurs. Impaired vision. Vision loss may result from a stroke that affects the area of the brain that controls and processes information from the eyes. Depending on the degree of the stroke, vision loss may be present in either one or both eyes. Dizziness. Dizziness or a feeling of swaying may happen after a stroke, depending on the area of the brain that was affected. The cerebellum-related symptoms of a stroke.